Most of them can be done. I mean, the fact of the matter is some are not necessarily suited for robotics because they're relatively simple. I mean, a tubal ligation you could do with robots, but it doesn't really, it's kind of a, having a, I guess, I don't know, Mercedes when all you need is a bicycle. It's a little bit different. But for difficult surgeries, I think if a person has pelvic pain, endometriosis, fibroids, heavy bleeding, prior surgical procedures that have been done, and you're not sure about the amount of scarring that may occur, that's where robotics really fits into the scheme of management. And to be quite frank, most patients have had some of those issues already, so a lot of times they do fall into a category where robotics is very beneficial. And also it really helps with difficult cases, whether you recognize it's going to be a difficult case going in or whether you get into the case and you find it's much more difficult. That's where your real benefit of robotics is, because your magnification, your clarification, and the control that you have over the field, you then find that you can really do much more precise surgery, which is probably the biggest thing I think people have to recognize. It's much more precise than it could ever be open. It doesn't mean that you can't do a good job open, but it's like me looking at you now, but then taking binoculars and looking at you. I can see much more detail about you just by virtue of the fact that I'm able to see you better. And that's really what happens with robotics. You really can just see so much better. So if you know where you are and you know what you're doing, you have a much better chance of being more efficient and even better at what you're doing.